Welcome back to Fluvoxamine Frontiers, battling COVID 19, where we are uncovering fluvoxamine's unique role in the pandemic. I'm your host, Dr. Soma Rohatgi, joined by our guest, Saakshi Sharma today. We are putting fluvoxamine side by side with other COVID 19 therapies like Paxlovid and see how it stacks up. Think of COVID 19 treatments as tools in a toolbox, each designed for a specific job. Fluvoxamine, an anti-inflammatory, and antivirals like Paxlovid have different strengths. But how do they compare in the fight against COVID 19? Let's find out. Saakshi, let's begin with the comparison. How does fluvoxamine stack up against antivirals like Paxlovid in treating COVID 19?
Dr. Soma, it's a bit like comparing a hammer to a screwdriver. Both are useful but work differently. Fluvoxamine, as seen in the STOP COVID trial, reduces inflammation and prevents severe outcomes by calming the immune response, cutting hospitalization rates in high-risk outpatients. Paxlovid, which is an antiviral, directly targets the virus by inhibiting its replication, reducing hospitalization by about 46% in trials like EPIC-HR in 2021. Paxlovid is more effective at stopping viral spread early, but fluvoxamine's strength lies in managing the immune overreaction that drives severe cases. Fluvoxamine is also cheaper and does not require the same level of viral load testing, hence making it more practical in some settings.
So it appears different tools for different tasks work. Are there scenarios where fluvoxamine might be preferred over antivirals like Paxlovid?
Yes, Dr. Soma, there are clear scenarios where fluvoxamine shines. In resource-limited settings, like those studied in a 2021 Indian outpatient trial, fluvoxamine's low cost and oral administration make it easier to deploy than Paxlovid, which requires precise timing and is pricier. It's also a better fit for patients with mild to moderate symptoms at a risk of immune-driven complications, as its anti-inflammatory effects addresses cytokine surges. Paxlovid is ideal for high viral loads early on, but if access to rapid testing is limited or patients present slightly later, fluvoxamine's broader immune modulating effects, as seen in the Golden Gate study, make it a strong choice. It's about matching the tool to the patient's need and context.
That's indeed a great way to frame it, choosing the right tool for the job. Can fluvoxamine be combined with other therapies like Paxlovid to enhance treatment?
Combining therapies is an exciting area. Fluvoxamine's anti-inflammatory action could complement Paxlovid's antiviral effects, tackling both the virus and the immune response. A 2022 pilot study in Brazil tested fluvoxamine with other drugs like budesonide and found improved outcomes in some patients, suggesting synergy. Combining with Paxlovid hasn't been widely studied, but the different mechanism, no significant drug interactions noted in preliminary data, makes it plausible. The challenge is managing fluvoxamine's liver enzyme effects, which could alter Paxlovid's metabolism. Clinicians would need careful dosing as well as monitoring, but the potential for a one-two punch against COVID-19 is promising and warrants more research.
A combo approach could be a game changer indeed. Fluvoxamine is a versatile Swiss Army knife in the COVID 19 treatment toolbox, ready to tackle inflammation, whereas other tools like Paxlovid antiviral blade aren't enough or aren't available. This flexibility makes it a vital asset in the fight. Thank you, Saakshi, for comparing these treatment tools. Listeners, keep exploring with us on Fluvoxamine Frontiers. Stay curious Science is full of tools waiting to be discovered.